All right, good morning, everybody. Thank you for coming this morning. We have some good information to provide to you. As you might remember, we have completed a full first year as part of South Florida HIDTA. That's a high-intensity drug trafficking area. And, you know, unfortunately, we continue to see cocaine and opioids as the primary drug threats in South Florida. We also are seeing a resurgence of those and other drugs coming into our country from Colombia through the Caribbean into South Florida, which is why it's so critically important that we became a member of HIDTA and provide what we can do here to stop the distribution of those drugs throughout the state of Florida and the United States. The program and the Director Barrera, who was supposed to be here and is not able to be with us, has been very, very successful this year. And if he were here, he would tell you that South Florida HIDTA dismantled 47 drug trafficking organizations / money laundering organizations. They made 2,378 arrests. They seized 553 firearms. And of course, most recently, 62,000 kilos of cocaine. In total, their seizures are valued at more than $1.78 billion of drugs coming into the state of Florida. So HIDTA and the importance of it is critical. We've been a part of that for a little over a year and a half. But I can tell you that we've been working with HIDTA since 2006. We've been engaged in investigations throughout that time. We have seen great benefits over the last year and a half and even prior to our formal part of HIDTA. We not only help identify drug traffickers, dismantle and disrupt operations, but we also get funding for special investigations. Last year we got approximately $278,000. That can go for overtime, can go for training, can go for equipment. And those grant dollars, again, help us to provide a safer community. We also look at operational assistance for investigative purposes and intelligence assistance, where we share intelligence and they share with us. You know, since its inception and our partnership, we became involved in the overdose mapping system. We were the first in the state of Florida to participate in that. And it actually started in the Baltimore HIDTA area. And that has helped us map 304 overdoses since its inception. And after the Congressman gets a chance to address you, I wanted to talk a little bit more about how we're tracking overdoses, but more importantly, how we're preventing overdoses and some of the statistics that we have seen there. So it's my great pleasure to introduce to you Congressman Diaz-Balart, who was instrumental in helping Collier County become a part of HIDTA this past year.
Thank you, Sheriff. Good morning. How y'all doing? For me, one of the things that has always been evident in the years that I've been representing Collier County is the tremendous professionalism of the Collier Sheriff's Department. In every way, in every aspect, they have shown time and time again to be a world-class law enforcement organization, led by a sheriff who, again, has dedicated his life not only to law enforcement but to this community. And so, Sheriff, thank you for the service that you've done, for the team that you have serving this community. And a number of years ago, just one of the people that I most admire here in this community, Ed Morton, came to me and he said, you know, have you seen what Collier is doing? Already working on cases that frankly are model cases, are system-wide cases that should be part of, Collier County should be part of the HIDTA program. With that conversation and then speaking to the sheriff and his team and others, I was able to see firsthand what an amazing job the law enforcement, the sheriff and his team have done in law enforcement here. And so I was able to, working with the sheriff, working with his team, was able to get the federal government to recognize that this department, this county should be part of the high intensity drug trafficking area of South Florida. And so today we toured the facility, we toured what they're doing. And I will tell you, it's an amazing thing to behold. The relationship that exists between the sheriff's folks, the state attorney's office, the federal government, but also other law enforcement agencies, not only here, locally, regionally, nationally, and also, frankly, even they're able to go and deal with international cases. And again, all this is because of the amazing professionalism of the Sheriff's Office, of the Collier County Sheriff's Department. It's been a privilege today to be able to see, a little bit over a year after they officially became part of HIDTA, what the difference has been. And sure enough, you can see, as the sheriff said, it's also, it deals with some funding. But even more than funding, it deals with that association now that they have, a direct association with other law enforcement agencies around the country. And again, in some cases, the cases can extend to even other places of the world. So, Sheriff, first let me thank you, you and your team, for the amazing job that you're doing. And whether it's your team, the state attorney's office that is represented here as well, the federal government that's represented, and others, the efforts that you do day in, day out, that your heroes do day in, day out, in association with other heroes, is actually paying huge dividends. The sheriff mentioned some raw statistics, but as the sheriff and I both know, and all of us know, these are human beings. And when you're dealing with, frankly, criminal organizations don't respect boundaries. They don't care if it's Collier County, Miami-Dade County, Henry County, they don't care where it is. But again, this Sheriff's Department with its partners are doing a phenomenal job, and thank you for allowing me to see the job that you're doing day in, day out, that I've been witnessing for years, but now seeing where you do it from. It frankly just is impressive, it's heartwarming, and it's humbling to see what these professionals are doing day in, day out. And I'm just lucky and proud to be able to be a little bit of help to what your department does every single day. So thank you, Sheriff. Thank you.
Thank you, Congressman. You know, you've been with us in the past. We've told you that we do not tolerate drugs in Collier County. We will do everything that we can to stop them from coming into the county or going through the county or being used by residents of the county. And with that in mind, you know, prevention, intervention, and arrest are the three mechanisms that we use here. We're always looking to prevent people, because if we can reduce the demand for drugs that might be coming into this country and intercede and seize those drugs and stop them from getting into this country, then we can make a very positive difference in lives in the future, because we are seeing that resurgence again. But one of the things, in addition to our overdose mapping, which has really given us information that we can address hotspot areas throughout the county, look at an emerging problem, step in, stop it, and change that direction, is the deployment of Narcan. The deployment of Narcan in Collier County is and has already begun to show a reduction in overdose deaths. So if we look at where we were in 2018, through the overdose mapping system, we had 173 overdoses. Unfortunately and tragically, 31 of those were fatal. And Narcan was deployed 98 times during that time. But if you look, since its inception, we have 49 resuscitations in the last year with the use of Narcan. That's potentially 49 people that could have died that did not. So far this year, we've responded to 59 overdoses. We've deployed Narcan 46 times, and we've only had 2 fatalities. So right away you can see between all of 18 and the start of 19, a dramatic reduction in overdose deaths. We'll keep you up to date on the statistics, and as the Congressman said, they're not statistics to us, although we have to keep them as numbers. They're individuals who tragically lost their lives due to addiction to drugs. And we'll do everything we can do to stop that in the future. We have a lot of partners, not only at the federal level from enforcement, but we have local partners such as the David Lawrence Center that help to get people on the right track so that they can survive and live a healthy life from here on forward. So from that, that ends the information that we have to provide. If you've got any questions, we've got some of our staff here that can respond. But those statistics and the reduction of fatalities due to overdoses is and will continue to be dramatic in Collier County.